Hello and very good afternoon, and welcome to our session on the topic Do's and Don'ts for your newborn. We are glad to have Dr. Satish Reddy, who will talk about the topic briefly. The doctor will help us understand the topic in detail. Just in case you have any doubts, any queries, you can put that in the comment section. Our doctor is here to help you. Doctor, you have the stage.
Yeah, good afternoon, everyone. Today, thanks for the introduction. Today, I'm here to discuss few basic points about do's and don'ts in newborn. Generally, it's more related to traditional and cultural practices. I would be discussing for care of newborn babies, which we encounter quite frequently in our day-to-day rounds and day-to-day encounter with the patients. So like generally tradition is a like knowledge, skills and practices based on theories, beliefs and experiences what our ancestors are given from different cultures, whether it is excludable or not. And every community has its own way. It is basically a region and religion specific beliefs of rearing children, which is ingrained in society through traditions established over centuries. These generally where does this come from? Like it is passed over from generation to generations, like from grandmother to mother, mother to daughter, and daughter to her grandchildren. So this is by and large based on core knowledge and wisdom of our ancestors. Some have emerged purely from superstitions and unbounded beliefs. And most newborns in countries like India, I would like to mention, like most of the kids, children, babies die at home while they are taken care by mothers, relatives and traditional birth attendants who follow their own cultural and practices and beliefs. Still the number is quite considerable. Most of the mortality is still high. Though hospital deliveries and literacy rate has improved, still the practices needs to be changed. So that's why I would like to bring about the discussion today about what practices are useful, what are harmful, and what practices are neither useful nor harmful. So, like estimated each year, around 4 million neonatal deaths occur exclusively in low income countries like India. The neonatal period is only 1 by 6th of the first 5 years of life, but contributes the death mortality which it contributes is quite significant. It's around 38% of the estimated 10.5 million under 5 deaths. So it's quite crucial to know what are the useful practices or the what are the harmful practices. So, as I said earlier, I would like to mention types of traditional healthcare practices which are practiced in India. Like first group would be useful, the second would be harmful, the third would be harmless but widely practiced, and fourth one is uncertain or of doubtful utility. So, coming to the useful practices, what are the useful practices? So, some of the useful practices are confinement and delivery at mother's place, so that the mothers or like housewives should be free from the household chores, and they can be very well taken care of the nutrition at mother's place, and they can rest and have a proper development of the baby during the pregnancy time. And other practices, isolation of mother and child for 40 days post delivery, which is also quite useful for both mother and baby. Mother can have proper rest and also take care of the baby well. And avoiding babies from post covid, we know how all the how important is the hygiene, hand hygiene and respiratory adequacies. So these children, small babies are quite more frequent to catch all the sort of the infections from the environment. So it is a very good practice to keep the mother and child a bit away from all the crowd and most of the visiting people. And other useful practice is universal and prolonged breastfeeding. That's a quite beneficial. So breastfeeding, as we all know, it's a quite beneficial. How beneficial is the breastfeeding? So most of the mothers, they do universal like prolonged breastfeeding and exclusive breastfeeding, like only feeding is quite important in the initial few days of the baby. I discuss regarding that in the later part also. And also use of cup, spoon or palada like a diya is also quite important for top feeding. Like some mothers will be complaining of insufficient breast milk insufficient breast milk. So in those people, use of a cup, spoon or palada, like they would, sorry, just a second. So There is a strict no for bottle feeding. Use of cup, spoon, or palada for top feeding is quite beneficial. Bottle feeding has its own risk, like it is more prone, always we have to sterilize the bottle. It is more prone for the later part of the life. Child will have more respiratory infections. Mm, respiratory infections. So it's always good to give the milk. If at all, breastfeeding is the ultimate one. If at all the baby needs some extra feeds, we have to go for express breastfeeding from mother only. Extract the milk and give through cup, spoon, or palada, if at all it is given. So that's a quite good practice. And also nursing the babies in supine position. Supine position in the sense head should be above lying position, normal lying position, which is quite helpful. So commonly, whenever the baby is in the prone position, like in the upside down position, there is a risk of something called SIDS, which is a sudden infant death syndrome. Most of the babies have that risk of SIDS when they lie in the prone position. So nursing the baby in supine position is quite good. Just so coming to other useful practices, oil massage is one of the definitely most useful and beneficial practice, and it is almost most of the grandmothers whenever we go for a newborn rounds, most of the first and most common asked in postnatal ward, especially by grandparents, is like whether to do a massage, what oil we have to use for massage, what is the thing, how to do massage, when to start the massage. So generally, oil massage reviewers suggested that massage has several beneficial effects in the form of weight gain, better sleep wake pattern, more neuromotor development, emotional bonding, and also lower rates of nosocomial infection in neonates and preterm babies. Also, it has shown to improve the skin barrier functions, thermoregulation. Mm, so, lubricant oil massage was found to be more useful than simple touch therapy. And the oil massage may have adverse effects such as skin rashes and bacterial colonization also, but it is negligible compared to the benefit ratio. The benefit is more than the harm. The caregivers, like particularly the caregivers, have to be properly instructed to avoid too vigorous massage that may cause physical injury, also enhanced and chances of infection. So oil massage generally has to be started when the baby is around 7 to 10 days old. Once the cord falls, once the umbilical cord falls, then we can start massaging. So once the cord is in place, there is risk that the cord might get wet and it may not fall and it may carry infection. So it is better practice once the baby reaches 7 to 10 days. Once the cord is dry, once the cord falls, then uh, the caregiver, like once they can start massaging, giving massage. So always we have to instruct the caregivers not to be too vigorous and pull the joints and all extend the baby's legs and all do all sort of things that may harm the baby and dislocate the joints. So it has to be a proper gentle massage. And as I said, like moderate pressure massage therapy and passive movement of like not a stretching or something, like passive movements go along with the flow of the limb. Passive movement should be beneficial in movement of in weight gain in preterm infants, and also it is found that it will increase the bone density. And that has also been found that it increases vagal activity, gastric motility, less gas issues, and it increases some hormone called insulin-like growth factors. So these are all beneficial. Less motor activity, less stress behavior. Just a second. Just sorry for the interruption. Um, it had also been found that less motor activity, less stress behavior, and more increase in vagal activity and a greater decrease in saliva cortisol levels that those massaged without oil was found. So coming to the oil, we stuff of the most of the grandparents and even parents should be confused. What type of oil should be used? Whether it is a coconut oil, whether it is a mustard oil, olive oil. What type of oil has to be used to massage the baby? So coming to the categories, so it has been found that pure coconut oil, like non-hydrogenated virgin coconut oil, has 92% saturated fat, which is blend of fatty acids with short and medium chain fatty acids. Primarily, it contains lauric and mystric acids. Studies have compared coconut oil versus mineral oil and a placebo like a powder also. So though it has been found that those receiving coconut oil massage showed more length gain velocity than the powder group. And uh, and less chances of dermatitis or skin reaction with the coconut oil. Also, it has been with olive oil, significantly damages the skin barrier. Therefore, it has a potential to promote the development of existing dermatitis, or it may exacerbate the dermatitis, skin, whatever the skin reactions that those children who are very sensitive, those children who have the skin reactions, it is bound to increase the skin dermatitis still furthermore. So, the use of olive oil for the treatment of dry skin and infant massage should be generally discouraged because of the damage it causes to the skin barrier. Also, sunflower seed oil preserves. It has found that sunflower seed oil preserves stratum corneum integrity, and it did not cause any erythema and improved hydration too. Although some antigen known as alloisothiocyanate in the mustard oil, which is very volatile chemical capable of causing contact dermatitis, has been found, and hence, after contact with mustard oil, irritant reaction being much more common than the allergic dermatitis. It has been found that even mustard oil is also a bit harmful to the skin. Despite, like in Indian study, despite of its widespread use, most of the caregivers use mustard oil. But despite of its widespread use by common flocks in India, the reports of contact dermatitis due to mustard oil are very infrequent in our population. So, oil massage is healthy and scientifically proven process which not only benefits the skin but also the growth and bonding of the baby. But however, as told, like the use of proper oil, proper techniques is very important. Improper technique or oil may be detrimental. So educating all the like doctors whenever the parents come for a follow up, whenever we go for a round. So generally we do educate the parents what oil should be used and what are the techniques of oil usage and what are the benefits we would definitely mention in our rounds. So educating the caregiver, preferably mother, in proper use of proper technique and use of either coconut oil or sunflower oil is recommended. Coconut oil will be more useful. So after the useful practices, let's see what are the harmful practices. Eating less during pregnancy to reduce delivery pangs. Um, some mothers do practice that eating less. They eat less during pregnancy. That's quite harmful, as we know that pregnancy, the need for nutrition is a bit more compared to the normal mother. So they have to take the correct balanced diet and extra nutrition during pregnancy. There is no any role of dieting or avoiding food or eating less during pregnancy. Also, use of rags or dirty clothes during deliveries should be avoided, which causes infections to both mother and babies. And during the child time of delivery, nowadays the institutional deliveries are more. So somehow it is good practice to deliver in hospital and all the hygiene protocols followed. That would be useful. But somehow in rural parts of India, using harmful and ineffective resuscitation practices like holding the baby once the baby is delivered, some practice that they will hold the baby upside down, which is absolutely wrong. It should not be done. And also some caregivers also do sprinkle cold waters on baby's face. It should not be done. And once the baby's cord is there, some caregivers do roasting or crushing of the placenta. It should not be done. And use of unsterile knife or blade for cutting cord, if at all it is an emergency delivery, or if people are delivered at rural areas where healthcare facilities are not available, then always make sure to use a sterile knife or blade for cutting cord. Use of unsterile knife or blade for cutting cord is quite harmful, and it will lead to lot of infections in the baby, and it ultimately leads to sepsis and mortality also. Yeah, and in some cases we have found that they apply ash, mud, cow dung, ghee, talcum powder, turmeric oil, and some herbal paste to the base of the cord. So these are all harmful practices which in fact lead to infections. And we have heard many grandparents telling about the application of cow dung or umbilical stump, but it is nowadays it has quite literally it has come down, but still it has been practiced in some areas. So it all leads to umbilical cord infection, which is common cause, one of the most common cause of neonatal sepsis and mortality. And clean practices, cord practices such as avoiding applications of all these things and using a clean blade is definitely useful. And one more harmful practice is giving prelacteal feed. Prelacteal feed is any food other than breast milk administered to a newborn baby before the initiation of breastfeeding. So we have a lot of religious practices in cases like before starting breastfeeding. Most of the caregivers, they, as a religious practice, they do give some prelacteal feeds. So one of the like study done in North India, which showed that 40% of the mother gave one or the other prelacteal feeds uh, during the baby's delivery. Few mothers said they also gave cow milk or water during the first 3 days as they felt that breast milk was inadequate. So what happens when we start giving prelacteal feeds is first is it is not at all tolerated by the digested by the newborn, and it causes risk of infection. And other thing is these are like mother's milk is absolutely good for the baby, and it delays like doing all these things delays the breastfeeding and secretions of the milk when we try to do these things. So only mother's milk is enough, and God has made made in such a way that mother's milk alone is enough, and it is the first vaccine administered to the baby. So no need of any sugar, water, honey. All these are harmful practices. Honey causes a severe infection, botulinum infection, which is very harmful to the baby. So don't give any sugar, water, or honey before initiating breastfeeding, because some parents they believe that giving sugar water or honey to the baby will make the baby happy, and they will live happy throughout life, and starting with a sweet. So that is not a practical fact, or this is absolutely a misconception. So never give anything apart from breast milk during the first 6 months. So the GI system is also not ready in the baby to accept all the things, and it will lead to sepsis, infection, and ultimately leading to death of the baby in some cases. As I said, honey is certainly dangerous. It produces botulinum spores that are difficult to handle for the tender kidneys of the baby. So all what we had to learn is honey can wait until 12 months. Sugars should not be given before 12 months. And also the plain sugar water can cause gastritis and babies tend to vomit. The other things like cows, donkeys, or goat milk, they are not absolutely not made for baby. So the protein and mineral content is quite high in those things, and it is difficult to digest for the baby. And some native medicine called wasambu, bonsian, or gripe water commercially prepared have concentrations of alcohol that could make babies very sleepy. So we encounter babies. Generally, babies do have colic issues in the first few days, like more prominent during the 4 to 6 weeks. So it has become a tradition to give gripe water, but gripe water contains some harmful products like alcohol, sodium bicarbonate, which is absolutely not good for the babies, and it will make the baby sleepy also. So some parents think that after giving gripe water the baby is doing well, so it is not at all true. So the alcohol and bicarb content of the gripe water makes the baby sleepy, and it is not good for the baby's gut. And in a study done from North India, it was found that 63% did not give colostrum because they believed that colostrum is difficult to digest and will cause a lump in to form in the stomach. So, as we all know, colostrum is the initial milk secreted from the mother. In the first 1 to 2 days, thin milk secreted in the mother. So, in most of the babies, most in few studies in North India, like they used to discard the colostrum. They used to think that it used to cause it is difficult to digest, and it used to form a lump in the stomach, which is absolutely false. Colostrum is like a first vaccine. It has the most antimicrobial properties, and it is most beneficial for the babies. So never deprive your baby from giving colostrum. So, in another study, the mothers considered colostrum to be a stagnant breast milk that had accumulated during the entire period of gestation. So, giving that colostrum or the first milk is very harmful to the newborn. So, which is a very false belief. As I tell you that colostrum is rich in proteins, IgA, and it's like a virtually first vaccine shot. Remember that never deprive your baby for the first initial milk. Nature has designed provision that infants be fed upon the mother's milk. They find they find their food and mother at the same time. So it So it is very useful. Initial milk, what we call as golden minute. Once the baby is delivered, within the first minute, the baby has to be given to the mother for skin to skin contact. And if the baby is doing good, then they can give for breastfeeding too. Like mother's love, there is no substitute to breast milk also. And in some rural areas, we used to now also we see that opium used for diarrhea. Initial few days, the baby do pass a stool with all the feeds. Like with each feed, babies tend to pass small amount of stool. So that's absolutely normal. That is what we call transitional stools. So in rural areas, what they do is they think that this is a diarrhea or the baby is having diarrhea. So they tend to give opium to stop the diarrhea or the gas issues. So as I said, it is very common in the first few weeks of life. They give opium to stop the crying child. And also it is either ways. Some babies do pass us a lot of stools in the first few days. Like with each feed, they tend to pass stool, and in some babies they may not pass stool for around 5 to 7 days. If they are passing gases and if there is no vomiting, if they are feeding well, they are happy, then no need to do anything for the first 5 to 7 days. If the abdomen is soft and if the baby is feeding well, if they are passing well, absolutely nothing to do. That is not a constipation. Babies do tolerate that. No need to give any castor oil or opium for that. Also, some of them pour or milk or oil or urine into ears, leading to encrustation and fungal infection, and even it has led to deafness. So there is no rule of pouring or installing oil or milk, urine into the ears or eyes of the baby. Also, we have found doing some parents do blow into the newborn's nose, which will damage their mucosa, and some tend to pour oil in nostrils, which may cause lipoid pneumonia and aspiration. So, absolutely no, no oil, no urine, or no milk to the ears or nose. So another harmful practice is like protecting the newborn from evil powers was one of the great concerns for all the women in the study. They believed that tying black thread to the hand or leg and putting black bangles, keeping bindi or the forehead, cheek, and sole using kajal or wasambu and following special ritual will ward off all the evil eyes and will protect the baby from evils. Similar practice based on beliefs or evil spirit was projected in another study from North India where 74.7% would keep knife under the newborn's pillow and few would keep matchbox under the baby's clothes to ward off ghosts. Some believe diseases as personification as wrath of goddesses. So there is few are harmful, like application of kajal in eyes is associated with the risk of trachoma and bacterial conjunctivitis. They also lead to lead poisoning in children. So minimal amount of application should be okay on the cheese and some apply on soles. That practice is okay, but not too thick layer of a kajal on the eyes, which is associated with the risk of eye infection. And one more harmful practice I would try to bring to your notice is branding. Branding is a traditional practice of making therapeutic like burn with hot iron rods over the skin for treatment of various diseases. Whenever newborn tend to have diseases, they used to think that it is caused by some evil forces, and they used to burn the newborns with hot iron rods, which is not at all preferable, which causes serious morbidity and also leads to um, death of the baby in some cases. And these treatment were used for initially for newborn jaundices, pneumonia, and convulsions too, which is absolutely harmful practice. So now they have brought a law which has been enacted by the Indian government for this issue, and it has been criminalized because this practice is common in rural areas of India. So we have come across some useful practices, some harmful practices. Come so now we will be seeing some of the harmless or inconsequential practices, like buying clothes only after birth of the baby and not wearing stitched clothes till day 6. So some parents do believe that buying clothes only after the birth of the baby and not wearing any stitched clothes, or sometimes they do believe that use of washed clothes, like it is neither beneficial nor harmful. This can be done, this though this doesn't harm the baby in any way. And also umbilical cord was buried in the backyard of home. So this the motive, somehow the motive might be different, but it doesn't harm the baby. and tying, as I said, trying the black threads, or even using some amount of kajal to keep off evil eye. Those things, few things which doesn't harm the babies are okay. And also in some communities we do see circumcision practice as a ritual, but it should be done by the healthcare professional and in a quite hygienic way. If done by rural practitioners or some in a harmful way, that definitely would harm the baby. And covering with yellow cloth to prevent jaundice, this doesn't harm the baby, so it is a harmless or inconsequential practice which doesn't benefit either. So, concluding, cultural practices are passed from generation to generation. They are a part of our society, hence more respectable and deeply rooted. So, in spite of government efforts and healthcare practitioner efforts to educate mothers and community regarding newborn care, still traditional beliefs and practice are still prevalent. So, certainly, some practices are useful, some practices are harmful. So, we have to know which practices are harmful and which need to be definitely stopped. Certain other practices which are harmless, by acknowledging and agreeing to these practices, medical professional can build a good rapport with the mothers and family, so that necessary desired behaviors and changes in family can be brought out. Women who face problems with being compelled to follow traditional newborn care practices, sometimes, like we hear many of the parents, mothers complaining that I was very reluctant to these sort of things, but my mother and my mother-in-law was insisting to give some or the other thing, or to do the harmful practices. So definitely they have to be made to talk to the doctor whenever you come for a follow-up. You can get them, like, we, the doctors, when they tell, they can educate in a better way. So women who face problems being compelled to follow the traditional practices suggested by family-centered teaching, involving their husbands and in-laws during the antenatal visits, could help them. And also, they believe that teaching the family would help with better compliance with educational messages that are shared in hospital than just targeting the antenatal woman. So, with this, I would like to conclude my talk. So this was basically based on traditional and cultural practices. In my next talk, I would be more happy to share others do's and don'ts, which involve uh, more practices leading to the more revolving around the urban practice, which would I would be very keen to talk in my next talk. You can message or comment your doubts, so that I would be more than happy to answer those things queries. Just a second. So, if any questions, just you can put it in the comment box later. Also, I would be more happy to do that. As of now, I won't see any questions. So, thank you for listening. Thank you. I would be closing the session.